What is counselling and psychotherapy? Why is there such a big stigma attached to them? Why do they induce such fear and shame? We rush to the doctor when we experience the most minor symptoms of physical illness. We also voluntarily go through physical checkups and tests just as a preventive measure. But when it comes to mental health, we ignore, repress, or simply don't consider mental or behavioral symptoms worth seeking treatment for. Tests and checkups for assessing our mental health are completely unheard of and not even considered. Why is there such a big disparity between the treatment of physical and mental health? Are the two processes really that different? Let us look at what happens in a regular counseling session in comparison with a regular doctor's appointment. When you visit the doctor, you state your health problem and describe the symptoms such as cold, cough, body ache, fever, etc. The doctor will ask questions to investigate further. The doctor checks your breath, heartbeat, throat, eyes, or blood pressure. They may recommend some additional tests and prescribe certain medicine and diet changes or even some exercises if required. You will then continue to follow up and consult with the doctor till your physical illness is cured. Now let's look at what happens in a counseling session. You state your mental health problem and describe the symptoms, which could be struggling with negative emotions and thinking, trying to come out of unhealthy behavior patterns, etc. The counselor will ask questions to investigate further. The counselor will assess your mood, emotions, and thought patterns. Ask questions about your lifestyle. They may recommend some psychological tests and, if required, prescribe some medicine. They will recommend certain diet changes or some exercises. You will then continue to follow up and consult with the counselor till your mental illness is cured. Do you notice any major difference between the two methods? The diagnosis process for both physical and mental illness follows the same pattern. Your symptoms will determine your diagnosis. Certain illnesses are less severe than others. In physical illness, flu, viral infections, minor bodily ailments will be cured by regular medication. Severe illnesses such as cancer or heart ailments will require hospitalization or surgery. In mental illness, anxiety or minor depression will be cured by regular counseling and some medication. Severe illnesses such as major depression, schizophrenia, or addictions will require hospitalization and rehabilitation. If the treatment process is the same, why do we treat them so differently? Our brain, like any other organ in our body, can sometimes get sick and will need outside help to recover. We should not hesitate to seek the required treatment. Psychotherapy can seem scary and uncomfortable, but so are injections. But we do take them when we need to feel better. Minor mental health struggles should also not be ignored and deserve attention, just as minor physical illnesses do. We give our body rest and time to recover when we are down with a cold, cough, or suffering from body aches and sprains. We also need to give the same kind of rest for our mind when we are struggling with excessive negative thinking, develop anxiety about certain events and situations, or have chronic mood swings and outbursts. Just as not addressing minor physical symptoms on time can lead to severe health issues, not treating minor mental health issues can lead to developing severe mental disorders. Let us not forget that our brain is also a part of our body and deserves to be rested, treated, and healed.